In this second video on the bones of upper limb, clavicle will be reviewed. Clavicle is also known as collarbone and connect the upper limb to the trunk. Although it is a long bone, it lacks medullary cavity. It consists of spongy or trabecular bone with a shell of compact bone. The shaft of the clavicle is a double curve in horizontal plane. The medial two-thirds of the shaft of the clavicle are convex anteriorly. Its sternal end is enlarged, triangular, and articulates with the manubrium of the sternum at the sternoclavicular joint. However, the lateral half is concave anteriorly, and its acromial end is flat and forms a acromioclavicular joint with the acromion process of the scapula. The clavicle can also be described using its superior and inferior surfaces. The superior surface of the clavicle is smooth, while the inferior surface of the clavicle is rough due to the attachment to the first rib near the sternal end by strong ligaments. There is a conoid tubercle close to the acromial end of the clavicle for the attachment of the conoid ligament, which is the medial part of the coracoclavicular ligament. Also, a trapezoid line is located near the acromial end for the attachment of the trapezoid ligament, which is the lateral part of the coracoclavicular ligament. The medial third of the shaft bears subclavian groove for the attachment of the subclavius muscle. Medial to the groove is the impression for the costoclavicular ligament. This is a depressed and oval area that attaches clavicle to the first rib. Muscles and ligaments are attached to the clavicle. As shown in the picture, lateral third of the clavicle has the attachment of deltoid and trapezius muscles. Similarly, pectoralis major muscle is attached to the anterior surface of medial half of the clavicle, while sternocleidomastoid muscle is attached to the superior surface of medial third of the clavicle. Near the acromial end, there are two prominences, conoid tubercle and trapezoid line. These serve for the attachment of conoid and trapezoid ligaments, respectively. Conoid and trapezoid ligaments are medial and lateral part of coracoclavicular ligament, respectively. In addition, subclavius muscle is attached to the subclavian groove, located in the inferior surface of middle third of the clavicle. Near the sternal end, sternohyoid muscle is attached to the medial end of the clavicle. Also, there is a depressed and oval area medial to the subclavian groove where costoclavicular ligament is attached. This ligament attaches clavicle to the first rib. If this video is helpful, consider subscribing or clicking the like button.